Hello guys, and welcome back to my channel. It's Yvette and I'm back with another video this week, and I am so glad to be back on YouTube. I just got done being really freaking sick. Like, I was so sick when I came back from Florida after my last vlog. Epcot, me and Ronnie got a virus, and I actually ended up going to the ER and everything. But that's like a story time for another video. I'm probably gonna post a TikTok about it. In today's video, I'm coming to you live from a brand new camera. My husband decided that he wanted to get me a GoPro Hero 11 creator kit. So get ready, because I'm coming back to you guys with tons of new videos, new content, new vlogs, and I'm so excited. So let me stop rambling and get right into today's video and what it's gonna be about. So today I'm gonna be talking about the pros and cons of the operating room. I decided to wear my scrub cap for today's video so you guys can get a better feel of my aesthetic during work. So let's start off on a negative note first. I want to get the cons out of the way because I want to end the video on a positive note, talking about all the pros that I love about my job. So unfortunately, my first con is that you have to learn everything on the job with the operating room. So the operating room is a place where you don't really get to learn your skills while you're in nursing school. You have to learn them once you get on the job, which kind of sucks. Fortunately, they do some places, but at least my place did. They offered a Peri-Op 101 course, and I'll make a whole separate video about Peri-Op 101 and kind of like what it was like to take that course and stuff in a separate video. But you basically get like a 6 to 9 month, maybe like 1 year orientation during that time, which for some people is like a really huge con, because people, you know, want to be independent and work independently and stuff. But the thing is that because you learn everything on the job, it is hard to learn everything that you need to learn about being an OR nurse in that year. My next con is the surgeons. Surgeons, some of them are really nice and some of them are really not nice. You're gonna get surgeons that like are super patient, and they're, you know, they don't mind telling you their glove size every single time they come into the room, or like what they need each case, or, you know, like what specific sutures they want for closing, things like that. And you'll get other surgeons that you like ask them like a simple question and they'll just be like, oh, losing their crap on you. And I don't like that. Like one time I had a surgeon, we were doing a spine case and we were resecting a tumor, and of course like that needs to be sent out for specimen and stuff like that. It needs to be sent to pathology, because everything that comes out of the patient has to go to pathology. A few levels that he was going to be working on, because it wasn't just the tumor resection that he was going to be doing. So then I was doing relief, and the relief nurse told me, oh, just like in 30 minutes or so, just ask him what he wants to call the specimen, like what levels is the specimen coming out of, because we need to know for our documentation. And I was like, okay, yeah, no problem. So I go to the surgeon while he's operating, of course, and I'm like, hey doc, what would you like to call the specimen? And he's like, operating, and he's like, spine tumor. And I'm just like, okay doc, but I need to know specifically where it's coming from. He's like, the levels that we're operating on. And I couldn't hold it, because I literally was like, we're operating on more than one level. Like, you need to be specific. So like you'll run into like little things like that, little bickers with surgeons, and then sometimes, you know, they'll get like really mad and start cursing or whatever. But like, you as a nurse should report that if that's the case. Another con about the operating room, which is not something that I go through because I don't take call at my job, but like some places you have to take call, which means that like for 24 to 48 hours, you call like a motor vehicle accident, a gunshot wound, a stab, or anything like that. Like it would be going in there for trauma call or just regular call. But unfortunately for me, I don't take call. So it's not really a my con kind of thing, but it'll probably be a problem if I ever leave my job. Another con about the operating room is that we have to work weekends and holidays. We do get like 1 or 2 holidays a year, 1 weekend every few months or so. So it's not like too bad. Like if you're an outpatient nurse, weekends and holidays would probably be like a deal breaker for you if you wanted to look into the operating room. Another con is the relieving shift. So I'm the relieving shift, and sometimes we get thrown into chaos. And we need to be able to handle whatever it is that's going on in the room. Like if I'm going into a room to relieve and there's just like things being thrown out everywhere, the patient's trying to like fall out of the bed, like we're still positioning, and we still have to do a count, I still have to give meds, like in whatever condition that the room is in, I have to be able to adapt and carry out the rest of the case. Another con is the nursing skill aspect. There's like a huge debacle in the nursing world about OR nurses not having nursing skills. And I'm not gonna lie to you, I have zero nursing skills because I went straight from nursing school into the operating room. So any nursing skills that I learned while in school is like absolutely not existent. Like these Foleys, anything like that, like V-tubes, like trach suctioning, anything like that, we do not do in the operating room. I mean, you'll get some places that require the nurses to do the Foleys, but fortunately for us, the PAs and the residents will do the Foleys in our place. For some nurses that come off of the floor, this is like a big deal. Like, oh my God, I'm losing like all the nursing skills that I picked up over the years, and it's like pretty much a deal breaker for them for when they go to the operating room. The next con that I have is being able to troubleshoot equipment. You're not like handsy with machines. You're gonna have to learn to be handsy with machines in the operating room, which is I was gonna need to be able to troubleshoot so much equipment in the operating room, but you do. Like, the last con that I have is a pro or a con depending on the nurse that you're talking to. Is that your patient is asleep. So you don't really get to talk to your patient, build a relationship with your patient. Like they only really see you in pre-op for a couple minutes, and then once you get into the OR, you get them all positioned up and stuff, and then they go under anesthesia. You don't talk to them again. Now getting into the pros, my favorite part of operating room nursing. First pro is that your patient to nurse ratio is 1-to-1. I cannot stress enough how awesome that is. I can work on one patient at a time. I'm very much a person that like, I can multitask if needed, but for me, patient care and patient safety is so big. So the fact that I get to like focus on one patient at a time is just like very relieving. My next pro is the hours of flexibility that you can work. There's operating rooms that will offer 8-hour, 10-hour, 12-hour shifts. So depending on, you can do like 5 days a week, 4 days a week, 3 days a week. Right now I'm on 4 days a week, 10-hour shifts, and I like it, I do. I wish that I had the 3-day, 12-hour shifts, but my hospital currently is not offering those. Another pro of the operating room is that sometimes you get to leave early. Sometimes the cases are all done and there's enough staffing, or like we have an overstaff and people get to go home, and it's pretty nice. The floor, like you're always gonna have patients and stuff like that. Like most of the time you don't get to leave early when you're working on the floor, but in the operating room you do get that opportunity. The next pro that I have is that you have a team in the operating room that is catered just for your patient, like, and they're all together there at the same time. It's not like the floor where you kind of have to like, oh, I have to call the doctor, oh, I have to call like respiratory therapist, oh, I have to call like so-and-so, or you have to call pharmacy separately, I have to do, no, everybody's pretty much in the same place. So if anything were to go down, you have an entire team there with you. You have anesthesia, which includes like the anesthesiologist, the CRNA, the surgeon, residents, fellows, you, the nurse, and the scrub tech. Sometimes you have vendors in the room that are there to like help out with equipment or trays and instruments and things like that. So like everyone is there for this one patient, and it just makes you feel kind of like you have a cushion, you know what I mean? The next pro that I have is that you don't have to go out and buy scrubs. As you can see, I'm in this little sweater that I got from Amazon, and I'll usually wear this to work, and then I just get scrub caps, but I don't have to buy scrubs because we get our scrubs from a scrub machine. So you have to do less laundry and things like that. We have to spend excess money on the scrubs, get them dirty, and then feel like bad about taking dirty scrubs home. Like you take off and put on the scrubs at work, so it just stays. The next pro is that you get to see some pretty cool surgeries. Like in my place, we do a lot of spine surgeries, and they're like very complex spine surgeries, like with like robots and different types of fusions and things like that. So you get to see like different techniques from different people or different surgeons, I should say. Let me put a little bit more respect on their name, you know. It's a very good conversation starter when you go to hang out with friends and stuff like that. They love to hear about like all the crazy stuff that I see in the operating room. So I really like feel like it's fulfilling to see all of like those crazy life-saving measures and like those comforting measures in the operating room. The next pro that I have is that you get breaks, and I'm talking like they don't bother you breaks. So I'm the relieving shift, I'm usually the one giving the breaks, but I know when I was doing those first case on time starts, it was like such a relief to see my break nurse come in and give us a 30-minute break, an hour break, an hour and a half break, and we would just go to the room or to the lounge and just have lunch and chat, and knowing that like there's a nurse in there taking care of your patient and you don't have to worry about anything is great. I'm glad that I've never had to like get up mid-break and go to my room because there's something going on. All right, guys, that's all I have for today's video. I hope you enjoyed. Please remember to like, comment, and subscribe and support me on my journey. I really, really appreciate it. I'm trying to take YouTube very seriously now. I've now gotten equipment and everything, so I'm so excited to get out like videos. Let me know in the comment section what you guys want to see next. And I will see you guys in my next video, okay? Bye.